You know, some parts of medicine sound like they're straight out of a sci-fi movie. Today, we're jumping into one of those areas, advanced reconstructive surgery. And let me tell you, this isn't just about healing. It's about literally rebuilding the human body, piece by piece.
So let's just start with the big question, right? How in the world do surgeons rebuild a limb that's been severely damaged? When a leg or an arm is just ravaged by an accident or disease, where do you even begin? It sounds impossible, but it's happening every day in operating rooms.
And the answer, well, it's not just about what you learned in medical school. It's this incredible fusion of different fields. You've got to be a biologist to understand the tissue, an engineer to figure out the mechanics, and honestly, an artist to sculpt a person back to being whole. All right, so here's where we're headed. First, we'll get into just how tough this kind of surgery is. Then we'll talk about the living surgical patch, a total game changer. After that, we'll see how new tech is giving surgeons high-definition vision, watch them fix what used to be called impossible, and finally, we'll take a look at what's next on the surgical frontier.
Okay, let's dive right into section 1, the challenge. Why is rebuilding a leg one of the absolute toughest things a surgeon can do? The stakes are just incredibly high.
Well, for starters, you're usually dealing with massive damage. The blood supply, which is the lifeline for any healing, is almost always messed up. That immediately cranks up the risk for infection and all sorts of other problems. And then you have cases like diabetic foot ulcers, where the circulation is already bad to begin with. Those are a whole other level of difficult.
So, with a problem this big, surgeons needed a game changer. And they found it. It's something called a perforator flap, which is basically like a living, breathing surgical patch.
Okay, so what is a perforator flap? The idea is actually kind of brilliant in its simplicity. Imagine you take a piece of tissue from one part of the body, say your thigh, and you don't just take the skin and fat. You carefully take it with its own tiny artery and vein, its own personal plumbing. Then you move that whole living package to the wound, hook up the plumbing, and boom, the tissue has the blood supply it needs to survive.
And look, this wasn't some flash-in-the-pan discovery. This was developed over decades, with a huge amount of credit going to Professor Koshima. He started his pioneering work way back in the 80s, but it was a big demonstration he did in 1997 that really put this technique on the map globally. And today, these flaps are absolutely fundamental to reconstructive surgery.
Okay, so surgeons have this amazing surgical tool. But what's next? What if you could give them, well, kind of like surgical superpowers? That's exactly where technology comes in, creating something we could call surgery in high def.
And this right here, this really tells the whole story. The old way of doing things relied completely on the surgeon's hands-on experience and their mental map of human anatomy. It took about 20 minutes. But now, Dr. Wu Xing has demonstrated that with a special imaging device, you can literally see the invisible blood vessels you need. And the result, the time it takes is cut in half, just 10 minutes.
And the result? The actual impact on patients? It's just wow. In Dr. Wu's study, he looked at 41 really complex cases where they used this new tech. The survival rate for the transplanted tissue was 100%. Perfect. In a field this challenging, a number like that is almost unheard of.
But you know, it's not just about the numbers or the speed. As Dr. Wu himself said, it's about confidence. When a surgeon can see everything clearly, they can work with more accuracy, more reliability. And in a surgery that can change someone's life, that confidence is everything.
All right, we've got the technique, we've got the tech. Let's see how they come together to tackle something that was, for a long time, considered almost impossible to fix properly, the diabetic foot.
So when a surgeon is facing this, they've basically got two main paths they can take. The more traditional way is to use a muscle flap. It works, but the results can look a little bulky, and the patient might not get much feeling back. But Professor Koshima, he really champions using these free flaps. Why? Because the aesthetic results are way better, and crucially, they give the patient a much better chance of regaining sensation in their foot. But here's the kicker. What happens if the blood supply in the damaged leg is just gone, blocked off? This is where the real genius kicks in. First, they use an angiogram to map out exactly where the blockages are. Then, they take a free flap that has an extra long, healthy blood vessel. And they use that vessel as a living bridge, literally bypassing the blockage and getting blood flowing again to the rest of the foot. It's incredible.
And here's a really cool biological fun fact that makes all of this work so well. It turns out that even in diabetic patients who have terrible circulation in their feet and lower legs, the main artery in the thigh,
The one they use for these flaps is often in surprisingly good shape. It's like nature left them the perfect spare part, right where they need it.
It's just incredible how far we've come. But you know surgeons, they're always looking ahead. They're never satisfied. So the question becomes, where do we go from here? What does the next frontier of reconstruction look like? And the future looks like something straight out of science fiction. We're talking about AI that helps guide a surgeon's hands. We're talking about combining custom-made artificial joints with lab-grown blood vessels. We're moving towards a world where the goal isn't just to save a limb, but to perfectly restore all of its feeling and function.
But with all this talk of AI and futuristic tech, it's really important to look at what makes the biggest difference right now. And you might be surprised. The data shows it's not the patient's age. People over 65 do just as well. The single most significant factor for success comes down to pure surgical technique, how precisely the surgeon connects those tiny blood vessels. It all comes down to skill.
And that really brings us full circle. We've gone from a problem that seemed impossible to a future where perfect restoration is on the horizon. So the final question isn't just if we can rebuild a person, but how flawlessly we can do it. What does it mean for us, for medicine, when surgery can do more than just repair, when it can truly make someone whole again?